I'd really like to welcome to the stage Stephanie and Isabelle, who are going to tell us about the brilliant work they're doing and some of the asks that they're encouraging the government to think about.
Hi everyone, I'm Steph. I'm Head of Social Research at the Office of the Children's Commissioner. This is Isabelle.
Hi, I'm Isabelle. I lead on policy work around children's social care, but I've also been working on this report and this work, which is around poverty and also housing. So we're doing another project on housing.
And the piece of work we're going to talk about was delivered earlier this year. It was published in July. And we were commissioned... should I sort of... Next slide, please. Is that okay? Sorry. Yep. So our slides have a lot of text on. Don't worry, I'm going to talk through it as briefly as I can. We were commissioned by the government and their Child Poverty Task Force to deliver a piece of evidence looking at the lived experience of children living in poverty across England. This was designed to inform the task force's work and hopefully inform the strategy that we're expecting. Oh, amazing, thank you. We were expecting to be published earlier this year, and we're still waiting to be published. But this is the sort of a thematic overview of the findings that we gave to the task force earlier this year. The report is published on our website, and I'd really encourage you to look at that if you're interested, because the report has all of the quotes, all of the sort of in children's own words stories about their experiences, whereas I'm just going to sort of whistle-stop tour through the information that we have. That's the wrong way. A quick note on the language is that we talk about poverty, but the children we spoke to really rarely talked about poverty. They talked about not having enough money, they talked about their housing, they talked about their food, but the word poverty didn't come up naturally in their conversations. We spoke to 130 children-ish from every region of England. We spoke to children in schools, and we spoke to children who were kind of recruited through really helpful organisations, and Shared Health were one of those organisations, and we're very grateful for that. We had 4 research questions, first being, what is it like to be a child living in poverty? The second was around the essential costs, which was wording that we got from the Child Poverty Task Force. Third was around services, so what do children think services are lacking and what needs to be done better? And the fourth was around variation, so are there groups of children that feel differently or experiencing poverty differently to others? To start with, what does it feel like to be a child living in poverty? A lot of the findings focused on the emotional impact, certainly feeling worried. I think we were really surprised by how young the children we spoke to were, who were aware of their parents' financial situation. They were worrying about it and they were actively supporting it. They were borrowing money from friends, they were finding jobs. A lot of sort of adult-like responsibilities that you would hope a child under 10 wouldn't be kind of thinking about. We also sort of established that a lot of children and young people were kind of accepting substandard, dangerous living conditions, and their expectations for the services provided for them were really low. I'll come back to that a bit later. Children are always really ambitious and really aspirational for the future, but with older teenagers, you really saw that their experience of poverty was starting to impact their future hopes and aspirations. And we did look a lot at school, and school was often a really helpful, safe place for children, and it was kind of enabling those aspirations for the future, but poverty was often having an impact on their education. We supplemented this with some findings from a survey of 250,000 children that we did last year, and found basically across the board, children from lower income backgrounds were less likely to spend quality time with their family, they were less likely to feel safe and protected in their local area, they were less likely to have access to good healthcare, they didn't feel they had a healthier diet as other children, they were less likely to enjoy school, and less likely to understand the opportunities that they had in later life. There we go. Something that came up a lot that the Child Poverty Task Force wasn't expecting to kind of look into or speak to was safety in the community. So children felt really very unsafe, especially in London, especially in Manchester, and sort of city centres in high deprivation areas. They were kind of aware of knife crime, antisocial behaviour, gang violence, and that was really impacting their day-to-day lives. They were less likely to want to go out after school or come home late in the dark. We also spoke to children who had been victims of criminal exploitation, and lots of them were very honest about the fact that they were exploited because their family didn't have enough money. So saying, you know, if the gang member knows you don't have enough money at home, they can offer you money. And they were really aware that that was a contributing factor. Essential costs. The cost of living came up a lot, and that was the words that children used. Children spoke about cost of living, they spoke about heating or eating. The kind of words that you see in the newspaper, they were kind of experiencing it and relating it to their own lives. Housing came up all the time. We asked children, if your family had a bit more money, what would you like to do with it? And across the board, they would say, we'd live somewhere different. We heard stories about overcrowding, just poor quality and poorly furnished houses, children sleeping in beds that are too small for them, children who couldn't invite their friends over for dinner because their parents said no because they'll see the brats, and sort of lack of privacy, especially in temporary accommodation. Children were particularly aware of energy bills, so we did the field work over the winter, and energy came up a lot. I think something really struck me was one teenager who spoke about her mum had just had a new baby, and the older siblings had to go without food so they could keep the house warm for the baby, to keep the baby healthy. Travel came up a lot, particularly outside of London, where bus travel is free for children, but children saying that they couldn't do activities, they couldn't always get back from school on the bus because they couldn't afford it. Other additional costs to the school day. So uniform, children speaking about, well, there's a scheme where we can get a second-hand uniform, but what year 7 wants to go to school with somebody else's uniform on. And school supplies. So a lot of young people in college spoke about bursaries or schemes that their colleges had that meant that they could get the supplies that they need. But, for example, one young man couldn't get a laptop because he needed to pay £300 up front for the laptop and then claim it back through the bursary. So sort of schemes that weren't really accessible for children. So we asked what services need to be better. Again, housing came up a lot. So a lot of children felt really disappointed by the social housing that they had. Children spoke about feeling that they'd been betrayed, that they'd moved out of their house for repairs to be done and they'd come back and the repairs hadn't been done. Especially children in temporary accommodation felt they were quite vulnerable, that they were in shared spaces with grown adults, which I'm sure are all issues that have come up for you and been covered here. But children saying that they haven't had an adequate meal, so the only food that they have is some takeaways or school dinner. Food banks were used really widely, and then we had a lot of young people saying that their local food bank had closed down, and so now they have to go further or have less. And free school meals, which are obviously a fantastic kind of service for a lot of young people. The children spoke about the stigma of receiving them. So children who had to have a sticker on their uniform that meant they had free school meals, or they were put in a different queue or given different food. And then others who used sort of like a prepaid card, but the card only had enough money for a meal, but they were in school through break times, and so they weren't allowed snacks. Schools were seen as like a really essential service for children in poverty. But children with additional needs and disabilities were much more vulnerable to not being supported by the school properly. And it comes up to talk about health. Children basically felt that health and special educational needs, disabilities, that you had to be rich to be able to get a diagnosis and get support, because there were waiting lists that were completely kind of insurmountable for them. Other services, children wanted more information about employment, more information about what bursaries they could get to go to university and get further or higher education. And especially for younger children, they just wanted more opportunities for fun. We heard lots of children say, well, there's a local park, but the council never cuts the grass, so we're not allowed to go there. Or being unable to go to clubs because they couldn't pay for them. And kind of supplementing that travel. So if, especially for children in the countryside, if they want to go and play five-side football, they couldn't. It would be 3 buses to get there, which is expensive. Children spoke a little bit about the social security system, which was interesting. A huge awareness among some of the older teens of like exactly how much their parents receive in benefits and exactly how it doesn't quite meet the need. We asked all children, sort of at the end of the focus groups, the interview, is there one thing the government could change? And one primary school teacher, a primary school child said, yes, get rid of no recourse to public funds. It's not fair, which I think was just very surprising to see coming out of the mouth of a 10-year-old. In terms of health, again, as I mentioned, sort of waiting lists came up a lot, but also some young people pointed out that they could see that their kind of local health services just weren't thinking about their financial situation. So one example was a GP surgery that had merged with a different GP surgery further away, which meant that sometimes you could get an appointment in one, but sometimes you had to get an appointment in the other. And if you got an appointment in the other, you had to get 2 buses, and families couldn't always afford to get the 2 buses together. Children were very kind of solutions focused. They were full of ideas. Isabelle's going to talk through kind of these ideas later, but yeah, really interesting and kind of diverse solutions to problems. And then in terms of which one's then the variability. So I think we looked at kind of age, gender, ethnicity differences. Age, older children were more likely to be kind of taking an active role in the family's finances, more aware of kind of the money situation in the house. But also the gender split was quite interesting. So girls were much more likely to be providing kind of emotional support and taking on the sort of like burdens of their parents. And boys felt much more susceptible to sort of criminal exploitation and feeling that they're needing to go out and get all money for the family. In terms of ethnicity, lots of children spoke about kind of differing cultural expectations, both for good and for bad. So some people saying like, we're in this community and it's really tight knit and someone will always support you. And other people say, well, in my community, we don't talk about money. Like your parents need to provide for your family and it's shameful to talk about it. As well as some people feeling that the services they received were worse because of their ethnicity. The urban-rural split was also interesting just in terms of opportunities. The risk profile was very different, so urban communities had a lot more sort of safety concerns, whereas the rural communities felt that there was a real lack of opportunity to change or education or even for fun, really. And then I think the biggest variability was kind of sort of the postcode lottery. Lots of children spoke about one organisation or one trusted adult that really helped them, which is obviously fantastic. And I'm sure lots of people in this room are that person or that organisation for children, but the inconsistency of it was incredibly challenging. And it became really stark. We went to some schools when the teachers were buying Christmas presents for their students when they knew they weren't going to get any, and other schools where children were saying like, oh, I don't know if my school would really, I don't even know if they provide food. Housing came up throughout. There's a couple of quotes there, which I think are quite moving. So a 10-year-old saying that she's moved house 7 times, but she's in the current house for 2 years. And then another 10-year-old who was worried about having to move soon. We, as an office, were interested in the impact of housing instability. So we used DFE data and compared GCSE results of children who move 0 times compared to children who move up to 10 times throughout their school career, and the findings are quite stark. So there's a sort of direct linear correlation between the number of moves and the probability of passing the GCSEs. So it goes from 65% ever pass in maths and English if you don't ever move house, to just 11% if you move house 10 times throughout your schooling. And as Isabelle said, we're going to be looking a little bit more at temporary accommodation in the next few months.
I'll just start by saying we're just going to quickly run through one slide, which is some findings from some work that we recently published in September, and it kind of provides like a good bedrock for I think a lot of where the Commissioner's like big ambitions are at. And then I'm going to go into talking about some of the specific recommendations from this child poverty work, and also preface it by saying that it's very much a summary, and there's like a lot of kind of buckets of recommendations in the report. I would really recommend going through that in more detail if you're interested. So yeah, the school census. So in September, our office published a big piece of work, which was a survey of all schools in England. We got coverage of 90% of schools. And there was kind of a couple of key findings. One thing that came out very strongly was kind of like a lack of awareness, often of like additional needs of children in schools. And kind of one thing I wanted to point to is that 60% of schools could not report exactly how many children were living in unsuitable accommodation. Very concerning. And this kind of leads into some of the key recommendations that we made in that work. So one, the single unique identifier, which obviously is in the Children's Wellbeing in Schools Bill, has been like a huge priority for this current Commissioner since she came in. And we're really delighted to see it. But obviously a lot depends on its implementation and how ambitious that is and how fast that is as well. So we've been calling for that. We've also been calling for like a national statement of ambition for children. So just essentially a national goal for ensuring that all children can achieve the best that they can. And then a much broader focus on additional needs, thinking about like learning as something that happens much far beyond the classroom, and thinking about whether there could be like a new framework for what additional needs look like outside of the classroom, and also funding attached to that. So could there be like a new funding premium for sort of like targeted and specialist support that children might need outside of the classroom. So thinking about like schools as a hub, and then the much wider support that's needed around them. Cool. Next slide. And the one after. Yeah. So these, as Steph pointed to, are some of the areas, and again, are a summary of things that children told us throughout the child poverty work that they wanted to change. I'll also just say we presented a much longer version of this presentation and all of our recommendations to the child poverty unit. So the strategy team do very much have what children have said they want to change. So the first, I guess, thinking about housing and temporary accommodation, as Steph alluded to, there was often like a very high level of awareness of how irresponsive often like housing associations are to children. So they'll come back, as Steph said, one child talking about coming back from being away and the house and the repairs not being done. Just general like comments on wanting there to be much better temporary accommodation if they need to be placed into it. Reflections on needing more space, of course, cooking facilities, proximity to school, all things you'll be very familiar with. Free school meals, wanting them to be much better, the availability and quality of food, as well as food banks came up a lot, and not wanting them to be stigmatizing food banks and free school meals. An understanding of like their experiences from professionals more broadly and schools in particular. And they talked a lot about that like key adult relationship and having someone in school that sort of gets it. Effective kind of practical support at school as well kind of went alongside that. A lot around like aspiration and career opportunities, and again that kind of tied into like if there is like a specific organisation that had been helping them, reflecting on that and how it had made a huge difference for them. Talking a lot about wanting to increase benefit rates and a striking level of awareness around that. Access to fun opportunities, clubs, things in their local area, basic things like upkeep of parks, etc. Transport came up a lot, and there was a real disparity, as you can imagine, between like London and other areas that we spoke to children in. And then again, also striking level of awareness around like wanting faster access to health, mental and physical healthcare support. And then also a lot around community safety, and yes, a lot around even like street lights. There was even mention of police community support officers and naming it like that. So that was really interesting, and yeah, we made recommendations around that. So yeah, next slide. Our recommendations fall into kind of two broad categories. So first, the Commission is very vocal on the fact that families just need more money in their pockets. So we've very consistently called for scrapping of the 2-child limit, which we will continue to do. We've also called for an uprating of child-related benefits, so like a triple lock for child-related benefits, I'm sure you're all familiar with. So that's kind of like where we start from. We're like, there has to be like foundational more money in people's pockets before we even take the conversation further. And then we made like a stream of recommendations around all different aspects of children's lives that covered the findings. So we talked a lot about like leadership and what good local leadership looks like. We talked about the role of schools and schools being better equipped. So things like, as Steph was alluding to, like changes to the way that FS free school meals are like given out, auto-enrollment for children on free school meals, and then some of those wider system ambitions around like there be much better funding for extra support outside the classroom. We talked a lot about the youth strategy, and obviously that's coming up soon, hopefully we'll publish soon, and wanting to make sure that children living in like lower income households and that like investment is targeted well to different areas where children need it most. And then like some specific programs we talk about needing to essentially be prioritised for low-income children. Safer Streets mission, we talked about making like visible reforms for children that feel like make them feel safer. So like better street lights, community like watch style initiatives, rollout of PCOS in areas where children are living in higher deprivation. And then I'll come back in the next slide to talk a little bit more about temporary accommodation, but we talked about essentially prioritising children for the affordable homes programme and the like rollout of house building that's going on. And then also made some recommendations about temporary accommodation. And then this all kind of wraps into the much broader ambition that we have around like linking children's needs up in a single children's plan, and like having essentially organisations communicate with each other around children. And yeah, these are just a couple of temporary accommodation recommendations that we made, which you'll all be familiar with. But the first one kind of speaks to this piece of work that we're going to be doing soon, which is looking at children who are housed in like B&B style accommodation and for over 6 weeks. And there's a kind of a key issue around council-owned B&Bs. So wanting that loophole to be closed. And then thinking about children being housed alongside other single adults. We're very clear that this is like a safeguarding risk and should never happen, and that should be updated in the code of guidance. And then likewise, if a child is placed in that area placement, there should be better communication around that. But we will be doing a piece of work essentially asking for some data from housing authorities on children who are placed in council-owned B&Bs for longer than 6 weeks. And we will probably publish that in the new year at some point. And then just finally, I guess, wanted to wrap up by saying, I guess as Steph opened, like children don't talk so much about poverty, and instead they talk about like how it feels and their experiences of it and the impact on their like daily lives in terms of their families and how they can have fun and what they can do. And yeah, as you can see, and there's much more in the report, like shocking, horrible examples of children's experiences. And I guess something important to say is that we are waiting on 3 big strategies: the child poverty strategy, the homelessness strategy, and the youth, the DCMS strategy, and I guess the school's white paper as well. So it feels like there's a lot of evidence and people have put out a lot of work ahead of those things, and they just haven't been published yet. So we're very much like pushing for all of our findings to be reflected in those strategies. We are doing an event next week in Parliament, which will be, we launched this report in July, but this is going to be the like big event around it. We're hoping to get a minister there, and the Commissioner will present some of the findings, and we're going to have some of the young people that we spoke to. So it's very exciting, and we hope that will kind of garner some more support, and that hopefully we'll have a strategy soon.
So it's been really encouraging to see the Children's Commissioner and her team take up some of this. I think that graph about the correlation between GCSE results, the number of times you move, is so powerful. We think about the stories that we had this morning, the stories that we see a lot, children moving multiple times from hotel to hotel to temporary accommodation to temporary accommodation. It would be fascinating to do a correlation on temporary accommodation and GCSE results, because I think that could be very powerful. I think one of the things that I've been talking about is, can we risk stratify so that children, the number of times the child's moved is taken into account when the next move is decided. And the other thing that really struck me was, I'm so pleased that you guys are supporting the safeguarding call. It's one that we've been talking about a lot. I have very frustrating conversations at a government level about it, who just don't seem to get that it is a problem. But mixing single homelessness and family homelessness is like a toxic thing. And both groups are hyper vulnerable, and they are both groups that should not really meet each other until everyone's sorted out their lives a bit more. So, thank you so much for advocating for that, and I'd really encourage you to keep advocating that.